I think we're all aware of the circumstance that we're up against, the privatization, the situation that we're all facing in every area of this province with the healthcare crisis that's being exacerbated by literally every level of government. And I'm just delighted so many of you have come out. And my co-host, Mary Jo, is having some computer issues. She was to start off this evening, but she will
Are you
join
able
us
to hear me, Carolyn, now?
shortly.
There
Mary
she
Jo, are
is.
you there?
I'm here.
Well, you just take over. I was just
Carolyn, thank you so much. I'm really sorry, everyone. I swear I was here early and I was fine. So I don't know what happened, but I'm grateful that you were patient, and thanks, Carolyn. Okay, so hello, my name is Mary Jo Neighbors, and I'm a representative of the Scarborough, Toronto, York Region Health Coalitions, and I'm honored to be here co-hosting the Privatization of Healthcare Summit for these regions. I'm excited at the opportunity to be involved in the fight to protect our valued public healthcare system, and even more so to help facilitate getting others involved. Tonight's summit is all about the very real threat our current provincial government poses to our healthcare system, and why an organization like the Ontario Health Coalition is so concerned about it that they've organized summits like these to take place across the entire province, calling on a plethora of dynamic, experienced, and knowledgeable speakers and the various coalitions across Ontario to work together to get the word out to the general public. This is arguably the voting issue of the June election, and tonight you will learn why. So we welcome our speakers, our listeners and advocates, our tech support person and Torontonian Riley Sanders, and the media, who will be one of the vehicles by which we get this message out to as many people as possible, as soon and as frequently as possible. I'd now like to pass things back to my co-host, Carolyn, who will do our land acknowledgement.
Thanks very much, Mary Jo. So I want to give a short land acknowledgement. We feel this is extremely important, and everyone will agree with us, no doubt. So we are broadcasting today from the traditional lands of the Haudenosaunee, the Wendat, the Anishinaabe, and most recently the Mississauga of the New Credit. And Toronto and the areas around it, so-called Toronto, is the home of many, many Indigenous peoples today. And when we give a land acknowledgement, we're not just speaking of the past, the colonial history that's taken place in this country, but we're also standing in solidarity with Indigenous peoples today and the many struggles that are taking place across this land, including the Wet'suwet'en in British Columbia, the people of Grassy Narrows in Northern Ontario, the campaign on missing and murdered Indigenous women, and so many more. And I'm sure you'll all agree with our sentiment that solidarity is so critical at this juncture, and they're fighting against some of the same forces that we're fighting against to preserve our healthcare system. And before we go any further, I also want to take just a moment to pay a brief tribute, just a momentary tribute to Shirley Douglas. Many of you know who she is, daughter of Tommy Douglas, who's said to be the father of Medicare in this country. But she, in her own right, fought so many battles, and most recently, in the last number of decades, trying to do all she could to preserve public health care in this country. She died in 2020 at the age of 86. I worked with her quite a long time, as did Natalie, and she dedicated her life to this struggle. And she always said that we are fighting the same enemy today as her father fought decades ago, the bankers and business people, the same insurance companies, the privateers who are trying to make profits off our healthcare system. But what she also said was it was the ordinary people in every province and territory of this land that fought the battle and won what we have today. It was those ordinary people in church basements, in similar rooms, in mosques, in temples, in union halls, and around kitchen tables where friends and family gathered. It was the ordinary people who understood that it was up to them to bring in public health care and to save public health care. And we're in exactly that same situation today. It's that collective power that won what we've won in the past, and it's that collective power which will allow us to maintain what we have and to move even further. And I think that is why today is so important, in all of the other meetings, summits that have taken place across this province, where ordinary people just like yourselves have come together to say no to the privatization, to say no to the government attacks. And I think we've seen the momentum building. We've had very real victories, stopping the privatization of ambulances. I won't go into others, and we know we can do it today. So we've got real momentum, and this meeting today is part and parcel of building that strong movement that will allow us to not only maintain, but go forward. So this is a tribute to Shirley Douglas, and I just want us to keep her in mind and the huge struggle that she took part in that brought us here today. And she was a wonderful heroine, certainly in my mind. And I would say we're standing on the shoulders of giants. We're walking in those footsteps, and we can accomplish just what they have accomplished in the past. So I'll leave it at that and then go back to my fellow co-host.
Mary Jo, you're mute.
Thank you. Thanks, Carolyn. Extremely inspiring. It's perfect for tonight. Thank you so much. The summit tonight is going to be broken down into two main segments. A set of 4 speakers will share their thoughts and perspectives on why privatizing Ontario's healthcare system is such an area for concern. We'll then provide a few minutes for the media to ask questions of the speakers, and then we'll move on to the second segment, how we as a group, how we as individuals take what we've learned tonight and get this information out to our communities. So when our fellow citizens go to the polls in June, they are fully informed on the issue. A few Zoom etiquette items. If you have yourself, please have yourself on mute unless at some point you're called on to speak. If you'll be asking any questions or making a comment later, you can use the chat feature, which is at the bottom of your screen. Simply click on the word chat and you can type in your comment. You can also click on the hand sign. If you go over to the reactions button on the bottom of your screen, click on that, and then you'll see a raise hand bar at the bottom of that little box. Okay, so you can use that as well. Now we'd like to get to our first speaker of the night, Natalie Mera. Natalie is the Executive Director of the Ontario Health Coalition. She has been a relentless advocate for public health care for over 20 years. She is an encyclopedia of information on the topic and instrumental in passing the Canada Health Act. She's a very kind and considerate person, but get her in front of a microphone or camera on a topic about which she is passionate, and she is fierce. You have likely seen Natalie on the news, on the agenda with Steve Paikin, quoted in news articles, and perhaps even in person at Queen's Park. And that's because she's a trusted individual with sound knowledge of public health care. If there is a threat to public health care for Ontarians, you will find Natalie there fighting to protect it. Thanks for being here, Natalie, and for organizing these summits. And please go ahead.
Thanks, Mary Jo, very, very much. And to you and Carolyn, to all of the organizing committee, I wish I could name all of you, to all of our friends here in the Toronto Health Coalition and in Toronto, who many of you have spent years with us fighting to protect, safeguard, and improve public Medicare. Just the biggest heartfelt thanks. I want to start by bringing a bit of a warning. I'm very worried about this provincial election. I feel like we're shadowboxing a little bit, that we have a government that has repeatedly done PR, press conferences and media circuits with interviews and so on, claiming that they're doing things that don't actually happen, or are sometimes the diametric opposite of the truth. And so on February the 1st, I was watching a press conference with Doug Ford, the premier, and the health minister, Christine Elliott, was there. And she slipped into this press conference, really a bombshell. She said, we're going to ensure that we let independent health facilities, which are private for-profit clinics, run private hospitals. And I just want to show you the video clip quickly. Do we have it? Sorry, I'm just checking with Sally.
Yes, just a second.
Okay. Sorry. I'm sorry. Here we go.
last week it was over 4,000. We have capacity. That's why we're doing things like releasing Directive 2 somewhat to allow for some of those procedures that people have been waiting for some time to continue. We're opening up pediatric surgeries, cancer screenings, making sure that we can let independent health facilities operate, private hospitals. All of those things are possible.
So you caught that, right? She said, we're going to ensure that we let independent health facilities run private hospitals, operate private hospitals. This is critical because private hospitals are actually banned in Ontario. They've been banned since the inception of the public hospital system, about a year after OHIP was created, and OHIP was created in 1972, and for good reason. Dr. Dick Zoutman and Michael Hurley are going to talk with you a little bit more about that tonight. But what I want to talk with you about is the fact that the minister said it. We can all watch it on video. And yet when we picked it up, we held press conferences about it across the province. The minister denied that she said that we were being accurate, and that denied that was actually what they were doing. Yet it's written in the written pandemic plan for Ontario that they are going to expand the use of private clinics and private hospitals. And this is a pattern. It's a pattern of behavior. It's sort of shameless. Privatization happens by stealth, but when it's called out, the government denies that it's doing exactly what it's doing. And the same thing has happened, but in a way that is just horrifying in long-term care. I want to tell you about a woman named Pierrette. She lived and she died in a for-profit long-term care facility. This was in the second wave. So not the first wave where they had might claim that the virus was new and they were taken by surprise and they didn't know much about it. At this point, we'd had months, 6 months, almost 6 months, more than that, if you actually took the lessons from around the world to prepare. The government had said that they have enough PPE. They said that they had created an iron ring around long-term care. The military reports had come out already. They swore never again. On multiple occasions, Public Health Ontario, the local public health unit, and the Ministry of Long-Term Care for the Ford government claimed that they had sufficient PPE in this particular long-term care home, sufficient staff, that they were following safety protocols. In fact, on September 11th, public health officials told the local media that things had changed since the first wave, and that they had gone in and made sure that those things were happening in the home. And the Ministry of Long-Term Care told the media the same thing. Yet on September the 19th, so just a week later, a staff person from that long-term care home went to the media, and speaking on condition of anonymity because she was afraid of losing her job, she said that staff working directly with residents who have COVID-19 did not have N95 masks, something that had been repeatedly raised with the provincial government and public health officials. The local media also received word from multiple staff in the home that care levels had dropped to the point that there were 2 PSWs for 60 COVID positive residents. Think about that. 2 PSWs for 60 residents. That's 1 for 30. There's no possible human way to bathe, to dress, to brush the hair, brush the teeth, do the foot care, reposition so they don't get bed sores, feed, provide any human company to 30 residents, particularly not residents with dementia who might be full care, or people with Parkinson's who need some time to eat, or people with COVID-19 who are sick and need more care, not less. But that was the level of staffing in the home. For the staff that went in, my heart breaks. Could you imagine? You'd have to choose who just doesn't get any care at all in your shift, who gets nothing, and who gets a little bit. Put one resident on a toilet, possibly move down the hall, do the next one, go back, get the first one off. There's no second person to do a lift. Mostly you just leave them in their beds and they wet themselves and they would be left there. There's no possible way to do anything else, but that's what that level of staffing looks like. We found a quote from Extendicare's spokesperson on September 22nd, particularly disturbing. This was an Extendicare home. It's a for-profit chain. They said, sorry, N95 masks are not recommended for long-term care. Can you believe that? That's what they said. If our staff indicate that they would prefer to have an N95 mask, we will make them available. By that day, 64 of 214 residents that lived in the home at the end of August had tested positive for COVID-19, almost 1 in every 3, and at least 11 had died. The PPE was on a separate floor. Staff would have to find management and ask management for them. They were locked up. And this was the response of the home. It's hard to imagine how the gulf between what the SARS Commission recommended to protect people from airborne pathogens like COVID-19 and the practice could be wider. At the same time, so around the same date, one of the staff reported to the media, a lot of sick people are getting sick really fast. Residents are getting sick, staff are getting sick. We think that we're not being given proper protective equipment in order to help us feel safe in our jobs. Remember, the staff would then be going home to their families, potentially infecting their families with COVID-19. Yet on September the 29th, so again, within that week, the spokesperson for Ottawa Public Health and for the Ministry of Long-Term Care said that they were meeting daily with the owner of the home, extended care, the local public health unit, and public health officials. They say there are no PPE concerns. There's no shortages of staff. Everything is being addressed. We have an aggressive testing, screening, surveillance regime. You know, this we heard home after home after home. People will remember this in Tender Care, in Kennedy Lodge, in Toronto, you know, in all of the homes with these devastating outbreaks. At the same time, this is the condition in which Pierrette was found by her daughter when her daughter went to visit her. She said Pierrette's room was dirty. She had excrement on her hands. There was excrement on the wall. It was dried. It had been there long enough to dry. She had not been cleaned. Her tongue was bone dry. And although there were drink cartons on her table, all but one had been left unopened. Pierrette had dementia and COVID-19, and she wasn't able to open a drink carton herself. There were not enough staff to stop residents from wandering. And there were residents wandering in and out of Pierrette's room, even though she had COVID-19 and was supposed to be isolated away from other residents so that they didn't get infected by the virus. There weren't enough staff to provide hydration and nutrition, human company, or even basic care. These were the conditions in the second last week of September, 3 weeks after the outbreak was declared. Pierrette died on Saturday, September 26th. Her daughter had been calling the home all morning. She finally got a call back from the nurse who apologized and said that the home was so short-staffed that she was covering 2 floors alone and hadn't been able to get into Pierrette's room until just before noon. Can you imagine? She had COVID-19. She had dementia. She couldn't open a container by herself. She wouldn't be able to do anything by herself, and no staff had been to see her until just before noon. She was dying. Her family was told by the nurse that she was dying. Sorry, this breaks my heart. And Pierrette's family raced to the home just in time for her passing. In the end, 88 residents and 46 staff in that home contracted COVID-19, and more than 20 of the residents died by the last count that I saw. Pierrette joins 4,500 human beings, 4,500 long-term care residents that have died so far of COVID-19, many of them preventably. And that does not include the thousands that died of dehydration, of starvation, of neglect, of a terrible lack of care, of denial of basic medical care. One would think in that circumstance that every stone would be turned over to make sure that we found staff. You know, people dying of starvation, you would think that they would get staff into the homes to provide the care. You would think that they would set a minimum care level that we've been asking for 20 years to ensure that would never happen again. You would think that the operators would be held accountable. The for-profit operators that Michael will tell you about have such so much higher of a death rate than the not-for-profit and public home operators, yet not one operator, not one owner operator, even of the very worst homes, has been fined. No one has lost their license. You would think that we would realize that this horrendous experiment with for-profit long-term care would be brought to an end, but that has not happened. In fact, what happened to Pierrette happened after the military reports were revealed in the spring of that year, and after Doug Ford promised tearfully in a press conference that no stone would be left unturned. That's a quote. That he would build an iron ring, that he would address the shortage of care, that people would be held accountable, that nothing would be left off the table. In fact, that fall that as Pierrette was dying in an extended care home from such hideous negligence, the government, the Ford government, was preparing a piece of legislation that they passed in November to shield the home operators from lawsuits for negligence, forcing the families who brought lawsuits to have to prove gross negligence and making it easier for the operators to defend themselves. In fact, the Ford government has promised that they would bring in a minimum care standard. In fact, they claimed they did it in the legislation that they passed last fall, but that legislation didn't bring in a minimum care standard. Actually, it didn't do that at all. In fact, they said that they were going to bring in inspections again, the comprehensive inspections that they canceled because the for-profit industry hates the annual surprise inspections, but they did not bring back in the annual inspections. They delayed them for 2 years. They said that they doubled the fines, but they never fined anyone. So yes, they're doubled in the legislation, but it's never been used. They promised that they would hold people accountable. That has never happened. And so when they say that they're not now privatizing the hospitals, and I'm glad we've pushed them to that, we can take credit for that. But do we think that 2 months after the election that they would actually not do it? Because at this point, they're privatizing COVID testing. They've canceled almost all the public testing. We have the lowest rate of public testing we've ever had. And yet we have, 100,000 people getting COVID per day? And they've contracted testing to for-profit companies. Canceling the public testing, cut the public, privatize it, hand it over to private for-profit companies, many of which are now charging patients $200 or more per test for a PCR test during the middle of a pandemic, in violation of the Canada Health Act, the fundamental tenet of public health care in Canada. They've privatized vaccinations, handing them over from public health and our public hospitals to private for-profit pharmacies. They privatized the functions of the Ministry of Health and Long-Term Care and of the civil service in general, handing them off to private for-profit consulting companies. They're midstream in handing more than 18,000 30-year beds, long-term care beds in 30-year licenses to the same for-profit companies, the same killer companies that are responsible for thousands of deaths of residents under their care in squalor. This is what's happening. It is unprecedented privatization. This is what's at stake in this provincial election, and we have to stop it. But the key thing we have to do is build the public debate about it, because people don't know that it's happening. It's happening under the radar and people aren't aware. So we're going to ask people, can you put up lawn signs everywhere across the city of Toronto and the GTA saying, don't privatize our public health care, I'm voting on it? Can we put up window signs and car decals? Can we make it so visible that everybody knows that it's happening, and that candidates, when they're going door to door, they know that this is a key election issue that they're going to have to answer for. And the leaders, when they get into debates, know that it's a key election issue, and that they're going to have to be accountable for. That's what we want to try and do with all of you, the 150 plus people who are on the line tonight. I know that we can do it because we've done it before. Michael's going to tell you a little bit more about how we've actually won, how we've stopped privatization many times over in Ontario. And I just want to end with this quote because I find it inspiring. I hope you do too. It's from Helen Keller, and she said, "I'm only one, but still I am one. I cannot do everything, but still I can do something. And because I cannot do everything, I will not refuse to do the something I can do. Thank you very much.
Thank you so much, Natalie. Thank you for putting such a clear picture of what we're up against. And, you know, when you see the stats in the paper, 4,500 dead, all of that, but when you paint the picture of the reality, it becomes so clear. And I think when you say that what our job is to amplify that, so it's not just us who understand, but everyone in this province who understands what we're up against. So thank you for that. And we'll be going on now to Dr. Dick Zoutman, who is the former chief of staff at 2 major Ontario hospitals, including Scarborough Health Network, and is currently a professor in the Faculty of Medicine at the University of Toronto and the Faculty of Health Sciences at Queen's University. He also chaired the Ontario SARS Scientific Advisory Committee a number of years back. Please, Dr. Zoutman, take it away.
Thank you, Carolyn. Just do a quick check. You can hear me okay?
Yes.
Very good, thank you. I have some slides. We're going to try to do a slide share and see how that goes, a screen share. And we'll have a go at that. And I think you can see the slides now. Yeah, okay, that's great. Well, thank you so much for the privilege to speak with you and meet with you today about a very important subject. I have made hospitals my place of where I park my car every morning for the last 42 years. I had the privilege of working as the chief of staff at Scarborough Health Network and until my, I guess I call it retirement, but like a hockey player, I'm coming back doing different things. This is a critical time in the juncture in the history of our province. Our hospitals are a unique and very special place. They are a key part of the healthcare system. They are not the whole healthcare system. It takes a whole variety of players, but it's important to keep our hospitals as a public resource, most certainly. You know, during the pandemic, where would you go to get your COVID test? Who set up COVID assessment and pop-up clinics? This is an example from Scarborough Health Network, but there are many across every community, every jurisdiction. They set up these pop-up assessment centers, vaccine centers, places you can go for help, and yet still today are able to, although with some constraints, unfortunately. It was the hospitals, often in concert with public health, working with others in the industry to provide care. And I can tell you that, you know, as the chief of staff, there was never a consideration about, you know, is there a profit in it? What's in it for us? It's got to be done, and we're just going to do it, you know. And where's the money going to come from? Well, we'll worry about that later. You know, we were worried about just getting it done, and it's an amazing thing to watch when our healthcare workers put themselves to this kind of a need and just turn their mind to it and just get it done under the most difficult sometimes of circumstances. And that's what we've come to expect from our hospitals. It's care first. We don't turn people away. We're open 24/7. And our healthcare staff have been working tirelessly throughout the pandemic, and they're exhausted. They're now getting sick in record numbers, and it's very difficult to manage this with our hospitals at this point in time. And that tells you that our system is in trouble. And one of the reasons it's in trouble is the funding, because we have the lowest level of per hospital or per capita expenditure in hospitals in Canada, in the province of Ontario, just under $1,500. Now you can look at that two ways. You could say, well, we're just very efficient. You know, that's true. What we get done for that kind of money in our hospitals in Ontario is unique. And it is public money, so it should be spent wisely. However, the level of funding is really much lower than it needs to be to provide the services that are necessary in Ontario. And furthermore, this information comes from the Ontario Hospital Association, by the way. Our costs per patient care are the lowest in the country at about $5,460 per stay, whereas they're much higher in other parts of the country. And again, that's either a measure of being very efficient or perhaps needing more funding. It's certainly an element of both. We work with what we have, and we provide tremendous care, but it's becoming more and more difficult. And it only took really the pandemic to demonstrate the vulnerabilities that we see. One of the reasons is the number of beds that we have per capita is some of the lowest, not only in Canada, but among OECD nations, 22 other OECD jurisdictions. 1.4 beds per 1,000 population is extremely low, which means, again, we have to be very efficient in how we use those beds, but it also means that we have a real predilection to people piling up in the emergency department, waiting for those beds, which is not efficient and good use of everybody's time, and is stressful on everybody. And we would do well to reevaluate this. And during the pandemic, of course, it just became obvious. Our length of stay likewise reflects this. We have to move people through. Nobody wants to stay in the hospital any longer than is necessary. You know, we're at 6.2 days, quite a bit lower than the national average, and quite a bit lower than other jurisdictions. And again, we need to carefully assess that and realize that while being in hospital for a shorter period of time is a good thing, it also means that other parts of the system have to be ready to see patients, such as home care, and which is in dire difficulties. Hospital utilization rates likewise have continuously decreased. And this is good. We used to admit people for cataract surgery. We don't do that anymore. Indeed, we can do a double knee or double hip replacement and send you home the next day if you're in the right health category, which is a good thing. But our hospital utilizations, again, have dropped dramatically, as you can see, over the last decades. Our hospitals are coping with that to provide care. And what that really means to me is that hospitals are more than just beds. The future of healthcare lies less in hospital beds to some extent, although I think we need more, is in hospitals providing ambulatory specialized clinical services and supporting home care and telemedicine and a whole variety of other areas. Many hospitals provide superb outpatient care for very specialized needs for patients that keeps them out of hospital, keeps them in their homes where they want to be. And so we need to really look at our hospitals as a multi-purpose provider, kind of like a Swiss Army knife that provides all forms of healthcare, not just that which occurs in an inpatient bed. We are working in healthcare in hospitals much more closely with primary care, home care, long-term care, and all the other community providers through the newly developed Ontario Health Teams. And this is the opportunity to provide a wraparound service for a community based on their needs, with the hospitals playing a really critical and central role. And hospitals are playing a very important role in the rollout of the Ontario Health Teams across the province. When you interject, as Natalie told in the story of the long-term care, profit into this equation, it just doesn't work in the Canadian context. I'm not so sure it works anywhere. This is a graph of the value of the shares of healthcare. America HCA, you can see it was a good investment in 2011, and where the stocks are, what they're worth to now. But that does not come into play in the Canadian healthcare system. I've been on the board of many hospitals, and that's not a conversation we have. We talk about our resources, we talk about the quality of care. Obviously, we talk about the costs. We don't talk about profits because it's not part of the equation. If you add in profits into for-profit healthcare, our Canada Health Act becomes, quite frankly, I think, meaningless. And we have a very different dynamic, one which I think is hazardous. There have been many academic studies looking at for-profit healthcare. This one is from 2002 from McMaster, where they worked on this, and without getting into a lot of detail, they looked at mortality in for-profit hospitals, and the mortality is higher in for-profit hospitals overall than in not-for-profit hospitals in the US. And I can make this paper available. It's from the Canadian Medical Association Journal. And likewise, if you take some specialized areas, why don't you just privatize pieces of the hospital? What about dialysis? Why don't we privatize that? Well, there's a number of well-done studies, this one in the British Medical Journal, that looked at survival curves. You're dependent upon that dialysis machine for your very survival. And they showed that in the for-profit dialysis group, there was an 8.75% decrease in survival over the 80 months that they observed these folks compared to those who were in not-for-profit. That's an 8.75% reduced survival if you're in a for-profit dialysis center. And a similar meta-analysis done again by the folks at McMaster, again published very recently, gives the same results with a 7% greater odds of death annually in patients with a similar risk profile in the profit dialysis centers, which if they expanded it over the US population, would account for 3,800 excess deaths that could have been averted in the US if the for-profit hemodialysis centers had the lower mortality that was in the not-for-profit. In other words, for-profit is associated with worse outcomes and higher mortality. My specialty is infectious diseases. Needless to say, the last couple of years have been kind of busy for me. Hepatitis C, however, outbreaks occur in situations where instrumentation in clinics that are for-profit, where they take shortcuts. These instrumentation for colonoscopy and other procedures, keeping it clean and cleaning these instruments is expensive. It's time-consuming. It's fussy work. It has to be done to an exacting standard. And it's very tempting to cut corners, right? And in this one example in Ontario, clinics who attended the clinic, 38% got hepatitis C in this outbreak. And that's needless risk to people's well-being and a real risk that you got to worry about in these sort of situations. I believe the consequences of for-profit private hospitals are the diversion of our healthcare human resources, our nurses, our medical technologists in all specialties, from radiology to lab and so forth, physicians, anesthesiology technologists, technicians, and so forth, out of the public sector into the private sector, resulting in a much worse human resource problem than we already have. And we honestly can't deal with that. There's a worldwide shortage of healthcare professionals, and this is going to make it much worse. The other thing that can happen is unions will not be welcome, wages will be reduced, working conditions will alter. We've heard some of the stories of how that can happen, and it doesn't take much to deteriorate the quality of care. And when you've got shareholders who demand a profit on their investment, because that's what being a shareholder is all about, which is nothing wrong with that, it just doesn't belong in healthcare. That becomes the dynamic. You've got to pay out, to your shareholders, because that's a key priority, where it's not a priority in our healthcare system at this point in time. And so I've already talked about the dialysis clinics, and the other is the murkiness as to where did the money get spent. That'd be very difficult to find out, and would be a real concern. So the benefits of our public system are obvious, and not-for-profit, I think, is essential. Our not-for-profit hospitals are always there when you need them. There's an alignment of the objectives of that hospital with the needs of the community they serve. I would also want to acknowledge the immense amount of teaching of healthcare professionals that goes on in our public hospitals, and how cost-effective, as I've shown, they can be. Also, the research contributions. Research doesn't turn a profit. It's not going to be part of private hospitals, and is essential for the future of healthcare, where treatments for things like COVID, vaccine research, and many, many other examples occur on a daily basis. Canada is a leading research country in healthcare. And those collaborations between our community partners and our providers for the benefit of our community. The beneficial owners of our hospital and our healthcare system should be the public and not our shareholders. Thank you very much, and I will stop the screen share at this time.
Thank you very much, Dr. Zoutman. I appreciate that. I think what you've highlighted is just further examples of how when profits enter into healthcare, typically it ends up worse for almost everybody. Long-term care is a big example of that, as we've seen. A lot of these things have existed before COVID and before the Ford government took over. It's not that they were all perfect when we went in, but I think it's worth highlighting for people who are listening in and maybe who don't know much about the Ontario Health Coalition, and that's that they're a non-partisan organization, that they don't favor one party over the other, that it wouldn't matter what party is initiating continued privatization of healthcare right now, they'd be speaking up and holding these summits. It would just have a different premier's name and a different party in all of the statements that they're making. So right now, though, it's happening under the Conservative government. And right now, this is the fight that we can win. And so thank you so much for all that information. And we'll turn it over now to our next speaker. Our next speaker is Michael Hurley. He's president of the Ontario Council of Hospital Unions and CUPE. Michael has led countless legal initiatives and partnered with community groups to build movements to safeguard public health services for over 30 years. He has fearlessly fought offloading and privatization of hospital services. He's the perfect person to have with us tonight because of his experience, and we're grateful for him being here, as he's been at many of the summits that have occurred already in March and April. Please go ahead, Michael.
Thank you very much, Mary Jo. Thank you very much, Carolyn. And thank you very much to the Toronto Scarborough York Health Council, and to all of you and your years and decades of experience and activism. And we're going to tap into that activism and the activism of thousands of people just like us across the province who are beginning the mobilization against the privatization of hospital care and of healthcare more generally. Natalie mentioned 4,500 seniors died in COVID. We led the Organization of Economic Cooperation and Development in terms of having the most deaths in long-term care of any jurisdiction in the world with a developed economy. And of course, as Natalie mentioned, because the Ontario coroner declined to do autopsies on many people who died, we don't actually have a true count of the numbers, but they're far more than 4,500. And those people died in conditions which shame us as a wealthy province in a wealthy country, and they shame us that people would die of neglect, of loneliness, of broken hearts, of malnutrition, of dehydration. I mean, dehydration is pretty simple to deal with. You just have to offer people fluids, and we fail to do that for thousands of people who perish. When you think about it, it's staggering. And of course, 3/4 of those deaths occurred in for-profit long-term care in Ontario, 3/4 of them. And some of these chains like Rika, which lost 8.6% of its residents in the first wave, or Sienna, which lost 6.5%, or Rivera, 6.3%. They lost an enormous number of the people they were entrusted with. The average death rate for the for-profits was 5.2% in Ontario. To put that in context, the average death rate of the not-for-profits was 2.8%, and the average death rate of the municipal homes, including the City of Toronto Homes for the Aged, for example, municipally run, higher staffing levels, 1.4%, 1.4 compared to 5.2. Even as the Canadian Armed Forces was occupying some of the worst actors in the for-profit long-term care sector, tens of millions of dollars were being paid in executive bonuses and shareholder dividends. Even as staff could not access PPE, even as the facilities had no infection control protocols, failed to isolate residents with COVID from residents who didn't have COVID. Even though those facilities had threadbare staffing, provided no meaningful PPE, often staff wearing garbage bags with soiled surgical masks, none of which was particularly effective against an airborne virus like COVID. Even though those were the conditions within the homes, money was pouring back to the shareholders. There was profit taking going on at the worst moment for the residents at a time when we should have been infusing money into the sector. And many of those residents were denied transfer, most of them, even though they might have been acutely ill, denied transfer to acute care hospitals. And I believe that's to keep the revenue stream for their beds up and running. So the basic rights that any of us have under Medicare to hospital treatment were denied these primarily seniors. And, this really is the essential moral question we're grappling with tonight. Are human beings profit centers to be exploited? Or, are they beings that should have all of our compassion, all of our resources, and if we can't make them well, we will do everything to make them as comfortable as they can be made. That really is the challenge. This phenomenon, as Dr. Zeltman said, that we're seeing in long-term care, you see mirrored in those meta studies, the one of the US hospitals with 30 some million patients in 26,000 public hospitals at higher death rates of 2% for adults and 8% for children. And why did the authors speculate there were higher death rates? Well, among other things, the reduction in the use of regulated staff, compelled by the fact that about 15% of every dollar had to be diverted away from the bedside and care to profit. And Dr. Zeltman referenced a couple of studies on dialysis, and both of them had similar casualty rates for the people on dialysis as compared who are being cared for in the private dialysis clinics as opposed to the ones being cared for in the public dialysis clinics. And in the meta study that was done by the great doctors at McMaster University, they found that the reason that the death rates were so high in the US example was that although the recommended treatment time at that time they wrote the study was 4 hours, say, for dialysis, the owners, and there's concentrated ownership in the dialysis industry, the owners decided to reduce that by a quarter without any scientific basis for doing that. They shunted people away from transplantation as an option. They reused medical equipment that was only designed to be used once and to be thrown away. They used it over and over, and they skimped on the use of regulated staff. I put it to you, this is kind of the inevitable result when capital enters a market. It is compelled by the people who have invested that money to yield returns. And in the case of healthcare, those returns can only be yielded by skimping and cutting and gutting the care standard. So Now we have the Ontario government speculating about private hospitals and private clinics. And, you know, we have studies, we have evidence about what we can imagine that will look like. And we have the recent memory of our own experience, our tragic experience, our shameful experience in long-term care. And so we're going to mobilize to push back against this. And I want you to take courage from the fact that, you know, people like, you know, the Ontario Health Coalition, this Health Coalition, and all of the others pushing together stopped the privatization of ambulance services under Mike Harris. They stopped the privatization of cancer treatment. Can you believe that that government contemplated privatizing cancer treatment? And in the case of private-public partnership hospitals, you know, first we won a commitment from the McGuinty government during the provincial election, where they were ultimately elected to scrap the P3 hospitals. They reneged on that, but they did subsequently agree that they would not transfer the staff over. And in Britain, when that staff transferred to the new owners, there was a 30% reduction in the numbers of staff. There are tons of examples of successful community uprisings and provincial fightbacks against privatization. And we're blessed to have the Ontario Health Coalition to help us to get organized and to coordinate us from community to community so that we can push back. Because when the facts are put in front of the public, when the moral choice is put in front of the public, we should all be confident that people will come down on the side of love and compassion. Thank you.
Thank you very, very much, Michael, for those really inspiring words. And I've always been impressed. You as a trade union leader have always understood the importance of the community who uses the services working hand in hand with the workers who provide the services. Is such an important link. And I think for you to end your comments on such an optimistic note, reminding us of the victories that we have had when we work together, and that never to give up hope that we can do this, and we have the momentum to do it, and we're going to continue to fight. Thank you very much for your words. I'd like now to introduce Michelle Jones. And
hello, how are you?
I'm good. Nice to see you. And we're delighted that you are here today, a long-term care advocate who lost her own grandmother at Craigley Long-Term Care Home in Scarborough. And we're just so pleased that you're able to come and share that story and your insights with us this evening. Thanks, Michelle.
Thank you. I won't keep you. You know, my grandmother's nursing home was actually one of the better run homes. The problem is every turn they made, this provincial government was in their way. Just a little background. I used to be in social work. I used to be frontline HIV/AIDS prevention. I worked with Dr. Sheila Basrer. I was actually in quarantine because they thought my group had been infected with the original SARS. So my training in airborne illnesses and in viruses, period, kicked in, because from the moment I saw this thing jump from 4 to 400, I immediately emailed my grandmother's nursing home, and their social work and executive team immediately emailed Marilee Fullerton. That was in January. I was on Twitter. A lot of people know me from Twitter. I have a big following on there. I was warning people on there. And some people were saying, oh, you're being a scaremonger. No. I know how an airborne virus works and how it can get into facilities like a long-term care residences. We never heard from Dr. Marilee Fullerton. We never heard from the MOH, not in January, not in February, not until they locked down this province. But my grandmother's nursing home, because of the family members and caregivers, were saying to them, what are we going to do if it gets in? How do we isolate? How do we treat? What's the protocol? Every step of the way, Ontario residents have been ahead of this virus, and this government has not. The fact that they're even thinking about privatizing more healthcare in this province should terrify everyone. I went in with full PPE. However, I was not given an N95 mask. So on November 16th, I was infected along with my grandmother in her nursing home in 2020. Why? Because there was no N95 masks there. And I had an N95 mask, but I was asked to take it off to put on the cloth mask because that was the policy from the MOH. Also in September of 2020, and I'm sure Natalie knows this, most of us LTC advocates and caregivers were asking, where are the rapid tests? Where are they? The nursing homes that were on top of things and the advocates were saying, where are they? Where are they? Where are they? They were delivered to Ford in August. I found out later after our infection that they rolled out a pilot project at a private retirement home where Mike Harris sits on the board, but you know, that's fine, but not at any of the long-term care facilities to see if they would actually work. Okay, so after my infection and my grandmother's infection, which she survived, they rolled out the rapid tests in January and had us doing it every single day. I don't know what good that was going to do anybody since everybody in there had been infected, but there he was sending it out 3 months too late. It's things like that. Towards the end of my grandmother's life, I then discovered that there is only one nurse at night and 3 PSWs for a facility with over 300 residents. He has not addressed the staffing shortages. They are using agency staff that charge 3 times what paying regular staff, paying them their worth. This cannot go on. The idea of them privatizing and bringing medical clinics into long-term care facilities, as an advocate, I was the one that would have to say to the nurse, because she had 40 other patients, 40 other residents, I think my grandmother has a UTI, can you test her? This is a nightmare situation. There are no standards in place. The standard of care isn't even going to be implemented for another 2 years. People cannot wait that long. No one should be dying of dehydration. And for the record, my grandmother ended up with a pressure wound that became necrotic. And a nurse called it the worst wound he has ever seen in his entire life. And the nurse on duty didn't have the time to tell me that it was getting worse. So we couldn't bury my grandmother with her leg down. This is what's happening in these nursing homes. It is not healthcare. This isn't even, and I'm telling you, she was in one of the better homes. When they finally figured out what was going on, this nurse was suspended. Ministry brought in. I still haven't heard anything. They went all out. We changed her room, round the clock care. The point is, when we had to put in the palliative care order, that is when I found out that there was only one nurse taking care of high maintenance residents overnight. So from 11 to 7 a.m., one nurse and 3 PSWs have to turn residents, check on their wounds, check on their dementia patients, Alzheimer's, Parkinson's. This is unacceptable. This cannot go on. The fact that this provincial government wants to privatize more parts of this. This is a for-profit model. It can't get any worse when you had 5,000 residents dying of dehydration, for God's sakes. My concern now is, I don't believe Doug Ford is going to be premier in June. There's no way. There's no way. But I don't believe the for-profit model is going to go overnight, no matter who gets in there. And I think right now with the Ontario Health Coalition and with advocates like myself who have big Twitter followings and know our social media savvy, we need to, one, get those rallies back. Unfortunately, this virus is so prevalent and so virulent and so sneaky, it's crawling all over Ontario. As someone who has dual citizenship to the US, I can tell you, if Ontario goes the way of the US, we are going to be in a world of hurt. I can't tell you the number of young people in my grandmother's nursing home with manageable disabilities, but they can't afford home care. They can't afford their home, to have a home outside of long-term care. The system is broken and we need to fix it. And we also need to warn people, because long-term care is not going away. And even if we toss Ford out of here, we have to start to warn people how to handle when they take their loved ones into a long-term care resident. We need to tell them what to look for, what to do, because I am very concerned that even if we get a new provincial government, this is not going to go away. We don't have a holistic approach to healthcare in Ontario as it is. And when we were leaving, I saw a lot of new residents admitted, and they were all under 40. So can you imagine how much worse it's going to get? Because you have a lot of issues, housing, affordable housing, a lack of disability supports. I know I have a good friend whose elderly parents, because her mother has dementia, are now looking at divorce in order to afford to go into long-term care. This is unacceptable. They can't keep her in the home because there's no home care available. This is something that is going to break this province. I want to see a province that takes care of you from top to bottom, from the time you're born until you take your twilight years. And that's not happening right now. And you know, it wasn't happening before, but at least we had a chance. I would just like to say that when I was in social work, my entire field was gutted by a very similar government. I think right now the idea of plastering this city with our signs, it's a wonderful idea, but we're gonna have to rally. We're gonna have to stand out there. I mean, we're gonna have to be out there and get our voices heard and let everybody know we're here. We need to be out there 5,000 strong in our N95 masks outside Queen's Park. We did it, and I want to thank Natalie and the other advocates who invited me in to speak on what was happening. That was 2 months before my grandmother passed, and it was cathartic and it was therapeutic, because I don't think people are ready to understand the real trauma that LTC families and caregivers are going through right now, because this particular government made it 10 times worse. I sent probably 30 emails to Mary Lee Fullerton. I don't know how this woman has a job. Never heard back from her once. And if I, with someone with my experience, was trying to warn this government that we needed to implement protocols to keep this virus out of LTC, never heard a word. All we heard was it's safe to go on vacation for March break. Well, it wasn't safe. And there was no iron ring. I can tell you that right now. There was no iron ring because even I was infected in full PPE wear. Not much you can do when you have old filters and no windows open in an LTC care home and no N95 masks. We need to plaster this city with signs. We need to reach out to the other parties, and we need to rally outside of Queen's Park, because there's 2 months to go and nobody is talking about the privatization of healthcare in this province. Thank you very much. Thank you for inviting me. Thank you so much, Natalie, for bringing me here. And I value everything I've heard tonight. Thank you.
Thank you so much, Michelle, and for sharing with us tonight your very private family story. And I know why you've done that, and it speaks to the reality of your family, but the reality of so many others across the province. Many others. And I think your vision of what you would like to see, a system that from the start of our lives to the end of our lives treats us with dignity and respect, is what we're struggling for. And that we do have to be out there rallying, making our point clear. And I will just mention to people, May 1st, there's going to be a very large rally with community and labor at Queen's Park, and hopefully we can start with many more. And for the healthcare, I know healthcare unions and others are meeting earlier at the ONA headquarters on Grenville Street, right close there. So thank you so much, Michelle. And I want to let people know, you've So welcome. I want to let people know we have a little bit of time for Q&A here. And I want to ask if there are any media, particularly if they have any questions of our speakers, but then we're then going to go on to the section that Mary Jo is going to discuss about what we can do, the campaigning, the signs, all the things that have been coming up. So firstly, I'd like to ask, are there any media present that have any particular questions? Riley, you help me out here if I'm not seeing anyone. And if we're not seeing any media, if anyone here has any specific question they'd like to ask, keeping in mind when we go into the next little piece around the campaign, we really want your involvement there, particularly on how you can get involved, what you can do, any questions related to that. So is there anyone who would like to ask anything? And again, yes, I see one question. Is that JM or Jim Mile? I think you're muted.
There, I think that's
There you
better
go.
now. Thank you for taking my question, and I'm very happy to hear all those speakers. They were just great. I need some help here in understanding something. The Canada Health Act is a federal statute, which I don't know a whole lot about, except that it's supposed to deny private hospitals, and yet this issue keeps coming up. Should not the coalition be devoting some of its attention, at least to the feds, to make sure that they strengthen this in some way so that the provinces don't try to chip away at it? It seems to me that there is some sort of chink, some sort of loophole in the Canada Health Act that allows the provinces to try to do this again and again. And it seems to me they were beaten back in the past, and yet here it goes on. So I wonder if Natalie could speak to that. And the second part very quickly is, wasn't there also a movement to try to place long-term health care into the Canada Health Act? And I wonder where that went. Thank you.
Natalie, did you want to respond to that? I'm not seeing anyone else's hand up at this moment. Go right ahead.
Sure. So the Canada Health Act, it's like a kind of Bill of Rights for healthcare for Canadians. And what it says is that all Canadians have the right to equal access to healthcare on equal terms and conditions, medically necessary hospital and physician care without financial burden. So without having to pay out of pocket when we're elderly, when we're sick, when we're least able to pay. That's what it says. So you're not allowed to be charged for your surgery or for your MRI or your CT. You're not allowed to be charged for your COVID test, for goodness sake, in the middle of a pandemic, for example. It does not say that they can't bring in private for-profit hospitals or clinics. That is in provincial jurisdiction. But because we have phoned every private clinic across the country, there aren't that many, right? Like mostly in Canada, surgeries and diagnostics are provided overwhelmingly by public not-for-profit hospitals and clinics. But in the provinces where they have allowed them to come in, they overwhelmingly charge patients extra user fees. In Ontario, we see this around eye ophthalmologists, like cataract surgery, where people go in for cataract surgery and they're being charged for cataract surgery. That's a violation of the Canada Health Act. It's up to the federal government to enforce it. It's also up to the provinces to enforce it. And when they don't, they're breaking the Canada Health Act. They're breaking the law in Canada, and they're also breaking Ontario law, which also prohibits that. So, so they can supposedly bring in private clinics, but the issue is that they have not, where they've brought in the private clinics, stopped them from extra billing patients. And even in British Columbia, where, under pressure from patients who've been charged thousands of dollars for surgeries in private clinics, the government did try to crack down on the clinics. The clinics have brought a legal case to bring down the laws that protect single-tier Medicare in Canada. So they want to bring down the provisions in BC that stop them from extra billing patients. And that case is ongoing. Our side has won, the public side has won, and the private for-profit clinics are appealing it. So, so this is the problem. It does engage the Canada Health Act, but it doesn't overtly violate the Canada Health Act right away until they start actually extra billing patients. That said, I am actually writing a letter to Doug Ford and the federal government, Justin Trudeau, to call on them to stop these private for-profit COVID testing clinics from charging patients for COVID tests. And I'm going to be putting that out next week as open letters. We're going to send it out to all of the media, and we're going to try and push as hard. I mean, it's unbelievable in a pandemic that they would let that happen. In terms of long-term care, what we called for before the pandemic, but also after all of the just egregious suffering in long-term care, was that the federal government set standards for long-term care across the country, that it required the provinces to provide a minimum level of care that provides for residents' needs, that they have inspections and accountability, that they report, et cetera. There'd be public reporting and so on. So a few key national standards that would make a difference in every province across the country. The Trudeau government actually announced in a throne speech that they were going to bring in national standards for long-term care. They said that they were going to amend the criminal code to hold seniors services accountable, but that did not happen. They haven't done it. They did give billions of dollars, most of which are going in Ontario to building for-profit, if you can believe this, for-profit long-term care homes. And there are no strings attached to ensure standards. So that is not the end of the issue, but yes, for sure. Once the provincial election is over, we will make sure to raise that as an issue again. But we have 7 weeks here, 7 weeks till the provincial election, 7 weeks to make a difference. I think you understand. And so we're at the moment going to focus on our provincial government, all of the parties in Ontario, the Ford government's culpability in all of this, and pressuring all of the parties in Ontario to make concrete commitments.
Thank you, Natalie.
Thank you very much, Natalie. We've got something in the chat which asks what defines a private clinic, and then I see we also have Charles asking a question. Charles, do you want to ask your question as well, and then people can come back on both together?
Right. I don't quite understand yet the labor situation in the homes, profit and nonprofit. Are they still not paying enough to attract workers into these homes? I'm rather confused on that. I've heard some of them are unionized, some of them are not. Could someone help straighten me out on that?
Can I just comment very quickly on that? I had a nurse tell me how much her hourly wage was, and it will shock you. It was $18 an hour.
Good heavens.
Yes, and that's union allowed. And yet the private agencies, and they wonder why they can't get nurses to work in long-term care. That's why they have to constantly bring in the private agencies. They're paying them $50 to $60 an hour, some of them $120. And in fact, at the end of my grandmother's time there, her main nurse, when we put the palliative care order, was an agency nurse. And he was kind enough to let me know how bad the situation is. I have own family members that are nurses that will not work in long-term care. One, because they're constantly understaffed. They make less than what retail workers make. The amount of pressure that they have is as bad as a hospital, if not worse. Like I said, one nurse for 26 high maintenance residents, and they're not even making $30 an hour. There's something wrong here. And then there's the PSWs. The PSWs make even less than that. And there are times when they're doing the job that should be of a nurse or a nurse practitioner, because there's just not enough staff. And they make $16, $15, $14 an hour. I had a lot of friends when I was in social work go into PSW work. None of them are in there. They're in completely different fields. In fact, a lot of them work in retail, because you can go and work at Nordstrom for $25, $26 an hour. But if you're a specialized individual working in long-term care, you're making 18 and working multiple homes. That's how the virus spread into so many homes, because not only do they not pay them benefits, they're only part-time hours. So 3 days a week from 7 to 3, And then a lot of these PSWs would go to another home from 4 to 11 to make ends meet. So that's just some insight there from what I learned at the end.
Thank you, Michelle. Natalie, did you want to also respond to that? And then we've just got the one other question that I see about the definition of a private clinic, if you want to take that on as well.
Yeah. Okay, so our hospitals are not for profit in Ontario. We have public long-term care homes, that's municipal long-term care homes, not for profit and for profit. The for-profits are owned by chain companies or by individual companies that run for profit. The not-for-profit ones are not-for-profits, and the public ones are owned by the municipality. That's for long-term care. For our hospitals are not-for-profit hospitals. They're run by nonprofit or religious boards of directors, in the public interest. And so the difference, so when you have private for-profit clinics, they are owned by private individuals or shareholders, and they're run for the profit of those individuals. I hope that's clear. The issue around the staffing, just to clarify, agencies are like temp agencies. And at this point, we have such severe staffing shortages across everything: home care, long-term care, hospitals, the worst staffing shortages we've ever seen. People are beyond burnt out at this point, and they have suffered tremendously. Many have gotten sick, thousands, tens of thousands have gotten sick in the pandemic, and many never to totally regain their health status. Some have died, and people have sort of retired early or left, as Michelle described. It's left us in this really serious staffing crisis. So part of it is burnout. The workloads in long-term care are impossible, and staffing shortages beget staffing shortages. If you go to work and you have to choose who gets care and who doesn't get care, and every day that you're not providing enough care, as a nurse, you're racing, in an ICU or in an emergency department, you go home at night and you just worry about what mistake did I make today that might have killed someone. That's what it looks like for the staff. And there's only so long that people can go on like that, and they leave, and they don't have the right to strike, but they have voted with their feet. They've left in droves, really droves. The vacancies have gone through the roof. And at this point, the temp agencies are just price gouging. They're just charging unbelievable prices. So when Michelle described understaffed homes that are bringing in temp agency staff at ludicrous prices to do the same work as the existing staff, if you quit as an ICU nurse right now, you can quit, go get hired by an agency, work as an agency staff, sometimes for double the pay, no weekend or evening shifts if you don't want it, so you don't have to work the overnights and so on, and leave your colleagues who have stayed loyal to their hospital and continue on with half the pay, all of the shifts that they have to cover and so on. Those agencies, Michael has described them as having a corrosive effect. They need to be banned. And the wages and working conditions of the workers need to be improved. That said, the for-profits have much worse staffing than the not-for-profits and the publics in long-term care. And the reason for that is the not-for-profits and the public homes choose how to spend their money differently. They don't take money out for profit. They put more money into staffing. The municipal homes, supplement funding for municipal taxes. The not-for-profits do fundraising for additional programs and services and staff and so on. And they add resources in rather than taking them out. And the wages are different. So just the other day, we asked on one of the summits of a long-term care worker, how much are you paid compared to how much they're paid in the for-profits? And she said that right now, the for-profits are paying for PSW $18, $19, $20, $21 an hour. The public homes are paying $23 to $29 an hour. That's the difference in the wages. It's huge. They also have more full-time workers, benefits, that sort of thing. So it's just better working conditions. And because they have more staff, they don't lose staff at the same rate.
Thank you very much. I'm afraid that we're going to have to move on to the call to action portion, but I see there is a question to Michael. Could you tell us about the challenge of unionizing nurses and PSWs? And I'm wondering, Michael, if you could respond in the chat. And I see Stacey Paperneck was here from the Ontario Nurses Association. Perhaps you could respond as well in the chat, because Mary Jo, I think, is ready to go on the call to action portion, which we don't want to miss. So I'm sorry if we have to stop at this juncture here. So Mary Jo, please.
Thank you. You know, all the speakers have brought up a consistent thing, right? That once profits enter in, we're no better off. We also know, based on all the experiences in long-term care that Michelle referred to, and thing, that when the quality of work is there, the quality of care is there. So unless you're going to pay your staff properly, staff them properly, provide the PPE or the other supports that they need, you're not going to have the care that we want, whether that's in a hospital, a diagnostic clinic, or in a long-term care home. And so the great news is that there is, I don't know, 150 people on here right now who are completely engaged in this. And based on the comments we're seeing in the chat, you're appalled at the stories that you're hearing about long-term care. You are clearly on board with the information that has been shared with by Dr. Zootman, Natalie, and Michael, and know that it's not the path we want to take. Now, we want to make sure, and Michelle, you asked about this as well, we want to make sure that when you step up and start getting involved and helping your communities know what's going on, it's not just asking your candidate from the Conservative government in your riding what's going on. We need to press all our candidates on where they sit with the privatization of healthcare. Make sure you're asking everybody, and so that you can make the most informed decision you can when you get to the polls. But the fact that you're all here is step one. And what we know with this fight, and as Natalie has referenced, that we need to get the information out to the average citizen who really just isn't aware that this is going on. It's privatization by stealth, and people's lives are busy and they can't always focus on every issue that's out there. So this is why we're here, and we're going to make it a job that we're going to work on together by getting the information out to our communities. So one of the best ways to get information out is obviously the visual side of things. And the Health Coalition has come up with some pretty awesome lawn signs, car decals, and window signs. And Riley, if you have a minute to put those up, as you're putting them up, I'll just explain them a little bit. These are things that we're hoping that you will all get your hands on, and we'll tell you exactly how to do that, and manage to get them out in different parts of the communities. Once people start to see those signs, they start to question things. They start to look for this information in the news and on the radio and online and that kind of thing. These colors are going to stand out. They're going to see them between now and the election in June. And there they are there. So you'll see the first one is a lawn sign, and it gives you the dimensions, 24 by 18, a window sign, 12 by 12, and a car decal is 12 by 6, right? And so what we're going to do at this point is show you these initially. What I'd like to know is, who is it that's here that would like one of these, would like maybe 5 of them, will have friends and family and neighbors and businesses that they know would happily post these signs or use the car decals. If you are wanting some of these, please type your name in the chat. This is one of many things we're going to ask you to do in this little bit, the second part of the summit, so that at the end we can gather all of the information. We have your information because you registered, and we will follow up with an email in a couple of days summarizing all of the things that we're about to talk about, where you can get lawn signs. We already have a wonderful group of people who have volunteered to be sign depots. So areas across Toronto and Scarborough and up in York region who have said, give me a whole bunch of signs. I will make sure that people in my area know where they can meet me on certain days, and we'll get the signs out to people. We're asking simply for a donation for the signs of $5, simply because we need that donation to help this kind of thing go. The Health Coalition depends on donations and fundraising. So the car decals and the window signs and the lawn signs, please put anything in there in the chat that tells us how many you might want, how many you could take, and if you even want to be one of the depots. You can put your general vicinity of where you'll be, and then when we do the compilation of information, we'll be sure to advertise your area as one place that people can get those things. What we've done so far, go ahead,
Mary Jo,
Patty.
sorry to
Yeah.
cut in there. I just
that's
wanted
okay.
to show everyone the website and how to get to it,
Awesome.
and the features there that they can find as well. So our website here is ontariohealthcoalition.ca, and if that brings you here, the very first thing on our landing page here is a slideshow which will bring you everything to our campaign. If it's not showing like this, there's a little arrow here and we'll show you a few different ones. So you want the one here that has our lawn sign. If you just click into this here, then it brings you to this page. And the very first thing here is the donate button. So if you're able to donate, or if you are able to pay for your signs, then you can just click here and it will give you the option to donate online. We can also take a check as well. So our address, I'll put it in the chat in a little bit, but then you can also see the dimensions of the sign below. As well, we've got our locations here for Toronto for pickup. So if you're volunteering to be a pickup area, we've got High Park, Liberty Village, North York, Little Italy, Unionville, and Newmarket, but we definitely need more, especially on the east side. So we'll keep that updated as well if anyone's able to volunteer to put up a sign or hold signs and have people email them to come get the signs there. We'll keep that page updated as well.
So being like a pickup spot, really you just need to put some signs in your hallway or in the garage, and the stakes come with them, right? The wire stakes.
That's right. Yeah.
And then people will email you, and then you just arrange a time and they can come by and pick up the sign. You could leave it outside your front door, so you could do it no touch, right? And so it would be great. We need a spot in the annex. It would be great if we could get a spot along the Danforth Riverdale, sort of on the east side of Riverdale, something towards the west side of Riverdale. We need a few places in Scarborough. If anyone has a spot in Scarborough. Where else do we need places? We have some in North York, which is, we could use some more in North York, actually. And we need some like towards Etobicoke and Mississauga. Is anyone in those areas? So if you are, it would be fantastic. And I'll be phoning some people to see if they would be willing to host, like hold some lawn signs, and it's just by email. That would be really great, because the more places we have, the easier it is to get them out all over the city. Just, can I interject with one other thing?
Absolutely.
Okay. I'm willing to go door to door for a couple weekends with people, if anyone wants to do that, to get the signs up. And I certainly need the exercise. It's great exercise. It's also fun. So if people want to do that, if you can put that in the, oh, look, there's a depot. Thank you. If you can put that in the chat, or if you're able to get out like 5, I know that like I probably have 20 friends that I could ask right away, just without thinking about it. And, if there's family and all of that, there's other organizations. So, if you're able to do that, it really does make a difference. And then just make sure they actually go up. Thanks. Sorry.
No, that's perfect. Thank you so much. So we already see some people adding some things in the chat. We're really grateful. So keep it coming. The other thing, Riley, if you don't mind pulling up, is the screen where they can click on where there's the different fact sheets and the bifold kind of thing. So tonight there was a lot of information, and you might find when you talk to your friends and family that it's a bit overwhelming to try to sum things up for yourself. You don't need to be the one that explains it all. You can actually print these off or email these links to them and provide them the information themselves. There is a lot of it, because there are a lot of areas that are being under threat of privatization, right? So feel free to, you can click on any of the ones there, the leaflet, it's a double-sided, and that's when they can be folded into like a booklet, right? And that's what I've done here. I don't know if you can see me if that screen is on, but that's what that is there. So feel free to share these when you're going door to door, like Natalie was suggesting. If there's anybody who lives in the area where you have, or wants to take an afternoon and walk down in front of some businesses, take a few window signs with you, a roll of tape, walk in there and say, hey, would you like to support this? And you can always give them some information as well. And if they say yes, grab that roll of tape and put it up for them. And that way, it's getting up there. We have people all over the province doing this exact same thing that we're asking you to do, and that we will be doing. At least 17 summits are happening. If they haven't already happened, there's just a couple left. So there are lots of people getting this information out. You're going to start seeing it around, and you're going to be able to tell people that you're asking to put these up. Say, hey, this is a big thing. It's a big movement. You're going to be part of it. And here, let me put that sign up for you. The other thing that we talked about was people saying dropping things in people's mailboxes, if you have that. If you have local events that you tend to frequent, whether it's markets that they'll be opening up soon, whatever way you think helps. Some places that people had thought about who've done these kinds of things already. And if you think of any, please put them in the chat if I don't already mention them. But if you're part of book clubs, if you're in a university women's group, any church, mosque, or temple groups, university, college clubs, and organizations. We would love to get more youth aware of what's going on because it is their future. And if this goes through faster than we're able to stop it, it takes a lot of work to reverse this kind of thing. It's possible, but it'll take a lot more work than if we put the work in now. So university, college groups, organizations, social justice groups, social media accounts, Twitter, Facebook, TikTok, Instagram. You can share the images that Riley just showed you of the lawn signs and things. You can share the links. There's also even on the Ontario Health Coalition's Facebook page. Again, we'll send these links out to you in our follow-up email. People can go who maybe weren't able to come tonight, or if you want to just review what was being said because there are a lot of information. The actual summit tonight has been recorded and will be posted on the Health Coalition's Facebook page for you to view.
Sorry, Mary Jo, can I just cut in there quickly?
Yeah.
Also, for the Mandarin speakers that are in the room here as well, 2 of these fact sheets have actually been translated, and I think you should have them. So if you can help us get the word out by sending it out on WeChat to your groups, things like that as well. Also, we're going to be putting the recording with the Mandarin translations as well up. So if you can send those to your friend, show your friends and family, and really try to get people aware and involved as well, it would be hugely appreciated as well.
Awesome, that's excellent. So if you already know, like I said, places that you may consider doing it, and I haven't mentioned them as part of the list, please put them in there. People will get inspired and think of things that they didn't think of on their own. Also, if you know a group or a group of people or business that would want to go in on even putting up a billboard, the Ontario Health Coalition will have a billboard design that they can provide you. That is a great way on certain key corners in your cities and towns to get the information out and start really getting people to pay attention to the things that they're going to be seeing around your area. If people you speak with would like further information, make sure you send them to the Ontario Health Coalition website. Also, another way to get involved, if you are a member of an organization, is to have your organization's name attached to the Ontario Healthcare's 1,000 member organization press conference that is taking place at Queen's Park on May 4th. It's the day the election campaign begins. And so if this is something that interests you, please let them know in the chat or reach out to them directly in an email and let them know that you'd like your organization to be on that letter at the press conference.
Mary Jo, can I just clarify 2 things? I just got a note. So one thing is we're asking for donations for the signs, the lawn signs, the window signs, et cetera, because we need to cover the costs,
right,
and because we can get out as many as we can afford. So we're just asking people if they are able to donate $5, but it's not meant to be a barrier at all. If you can't, don't worry about it, because some people will donate 20 and they'll cover a number of them, or 100 or what have you. So, and we're asking for only individuals, not organizations. This is all being funded by individuals who care, and that's what we want to do. So that's one thing. The second is I'd love to get a billboard, like a good billboard in Toronto. Don't you think that would be great? Like a really good visible one? If we could, it might be like $2,000. So that is 20 people who each donate $100 and the cost is covered. So if anyone wants to work on that with us, like, drive around, look for a good spot for a billboard, or if you see one, write down the phone number of whoever owns, it's usually on the billboard. And then if anyone wants to help, try and organize towards a billboard, I don't think it would be difficult to do. So if you are interested, will you put it in the chat, and Riley and I, or Mary Jo and Carolyn and Riley and I somehow will contact you about that. And then just the last thing, sorry, just to clarify as well. On May the 4th, the writs are dropped. That's when the election is formally called. The premier walks over to the Lieutenant Governor General's place, or I don't know if he walks, but anyways, and they issue the writs for the election, and the election is formally underway. And so on that morning, we're going to hold 1,000 organization press conference outside Queen's Park. Michelle, you called for a rally. This is the same thing, because there's going to be a giant rally on May the 1st. We didn't want to do another giant rally 4 days later. So we're going to do 1,000 organizations press conference. And we're trying to get 1,000 organizations to sign on to a statement laying out these as key election issues: improving long-term care, the things we talked about, ending for-profit healthcare in all of the aspects that we talked about, funding and building care levels and capacity in our public healthcare system in the public interest. So if you belong to an organization or you know of any, can you please let me know so I can try and get all of those organizations to sign on. And Carolyn was going to help with some organizations that she's linked with in Toronto. There's so many people that are linked with many organizations. It could be a cultural group, could be a faith group, could be a women's organization or an anti-poverty organization or a union or, you know, a professional health professionals or doctors organization or a community service, you know, any, it could be like a Rotary Club or a service club, any organization that you know that you think would support these demands in the public interest to set them as key election issues. If we have 1,000 organizations outside Queen's Park on the day that the writ is dropped, we're going to help to set the key election issues. And that's the goal. Okay, thanks, Mary Jo.
And we'll talk about the social media aspect of it, right? Yeah, you and I'll talk about that after.
Okay, Mary Jo, is there anything else you'd like to say at this juncture, or are you?
No, I
pretty well
think that's
covered it
that.
all?
I do
Right.
believe so. I think we've covered all the sort of ideas we have at the time. We're happy to collect the chat information. And like I said, in a couple of days, we'll send out this information a little more succinctly for all of you because you've spent now a good hour and 45 minutes of your time absorbing information. And we're really excited that you came and really excited that we have a lot of momentum going into this to win this battle going into June.
And I just want to thank the speakers who, many of them, it's not their first time at the plate for this particular issue. They came out this evening and I think gave absolutely tremendous presentations, everything one needed to know. And I think we want to thank the participants, obviously, because without you, there is no movement. And we are a movement of people. Without you, there is nothing. And it's you who are going to make the difference in this in this campaign. There's no two ways about it. And I want to thank the organizers who put such energy, not only here, but all the other ones that have been taking place across this province. And this is what makes a movement and what makes a successful campaign. And I think there's such momentum that's going on right now on this issue. There are other issues, they're all important, but this issue is critical. And the more that we can mobilize, the more that we can get those signs out and get those organizations onto the 1,000 listing for that media conference, all of it's going to make a difference. Because you know what? When sometimes they say, oh, you can't change City Hall, but you know what? Particularly during election time, they get scared, they get shaky, and this is the time to really push hard, hard, hard on every single party, and particularly, of course, the party that's in power right now. We've got to make change. We can make change. So we just want to thank you all for coming out. Get in touch with us. We've got the chat, as Mary Jo said. We will get in touch with you. But if you want any of these signs, talk to your friends about the signs, just get onto that Ontario Health Coalition website and just put your orders in, and we'll do everything we can to provide you everything you need. So thank you so, so much for coming out this evening. Bye, everyone.